Barton Healthy Newtown is one of 10 sites in NHS England's Healthy Newtown programme, where public health, NHS providers and commissioners, planning, developers and community workers come together to embed better health and well-being in Barton's new and existing communities.
The service that we provide has been running now approximately 2 to 3 years. The referrals come through via doctor's surgeries. We can actually come via the doctors themselves, can come via the nurses. It can be people that I've picked up within the community. It could be people that have just come in to see me as part of being here on site in Barton, and they've popped in with a problem, and then we signposted and supported them with whatever their needs are.
To come to Barton because I had what you call a mini stroke, and it helped me a lot to be moving my muscles, because I've never known any other surgery that done anything like that for us. And thanks to Dr. Collins and Sarah, I'm grateful. I can now write with my hand again, which I couldn't. I can comb my hair, and I couldn't do all of that.
None of it is medicated support. All of it is signposting support. They then access services. They've come to classes that we provided in the community centre. That's not only helping them with the health, that's also helping them emotionally, socially. So it's helping the people for different reasons and for different needs. It's helping in all different ways.
I was getting into my mid-40s and finding that my weight gain was increasing, and I wasn't doing a great deal of exercise. With discussions at a surgery, recommended to go and talk to the team here, and was aware then for the first time that this social prescribing department could actually recommend and suggest and put me in touch with the right people to get my first season free with Man v Fat. Subsequently then you pay for second and third, but that was a real motivation for me to think, okay, is this going to suit me? In the first instance, it was a great success and not too punishing. You know, we're only talking about half an hour of football. Personally, I've lost in 2.5 seasons 1.5 stone.
One of the big differences, what we have noticed since my role, is there's been a reduction in the attendance that patients have had with their own GPs. I have a regular contact with a lot of patients. I've been fortunate to be able to get to know patients on a more one-to-one level and get to know their needs individually. Knowing them on a more personal level, this role's enabled me to do that. I can identify problems, I can maybe identify needs that I can pick up. They don't even maybe think that it's a problem, and it don't always necessarily get to a doctor. It's a very fortunate in my position to be in, because your relationship with the patients is very different, and therefore so I think we've been fortunate that we actually get to see patients quicker. And there are a lot of patients that maybe we would never have seen, and they most probably would never come to a doctor until it's a dire situation. I think the project itself has been really beneficial. Number one, working closer with the Oxford City Council is great. I think the fact of having a good understanding of what the council are trying to provide for a community, having a community be party to the changes. I think patients are interested in what people have got ideas for them. They want to have a voice, they want to have a say. Part of the Healthy Newtown, I believe, is bringing old and new community together and trying to merge us together, and so it's not an us and them. I think nothing's worse than a new development and feeling if an old development is going to be left behind, and I don't think that will happen at all. We're not talking about two different areas, we're talking about one big community all coming together, and I think the Healthy Newtown already embedded is enabling that to happen. Existing Barton is already benefiting by what provisions the Barton Healthy Newtown are providing.